Hi YouTube, it's Cassandra. I am alive. Today is June 3rd, 2014. Tomorrow will be exactly 1 week post-op. Holy crap. The last 6 days have been interesting, to say the least. So, I know everyone wants to know numbers and whatever, but there's a few things that I wanted to talk about. So today I'm just going to do kind of a overview of my experience these last 6 days, and then tomorrow I'll do numbers for exactly 1 week, and then go into other stuff that I wanted to talk about. So May 28th, 2014, I had my, well, I kept calling it VSG, vertical sleeve gastrectomy, and I was informed at my hospital, in order for them to verify that I knew exactly what surgery I was having, I had to call it the laparoscopic sleeve gastrectomy. It couldn't be vertical. So excuse the terminology if it kind of goes back and forth. But anyways, Michelle and I got to the hospital at 5:30. Surgery was scheduled for 7:30. So yeah, some before 5, because I had to drop stuff off to the floor I work on, some treats, before I went down to the surgical floor. So I did that. Yeah, it's been 12 years since I've ever stayed overnight in the hospital, and that was when I had my daughter Kaylee. So other than that, when I was little and I had my tonsils out and tubes put in my ears, it was always outpatient, so I don't ever remember having to stay overnight. So let me just say first and foremost that I now have a newfound respect for all of my patients. And when they tell me that we as nurses and the doctors wake them up and don't allow them to rest, yeah, I appreciate them and I completely can empathize. Also, when they tell me that the roommate is horrible, I always thought, oh God, people just don't get along. You can't win. It's not a big deal. No, no, yeah. There are some people who should just never be paired as roommates, ever. A 30-something-year-old and 80s, 90s, you would think perfect match. Perfect match. Because that's what I would have thought. Oh, sweet little old lady, she'll be quiet. I'll get into that. So anyways, met with the nurse, the surgeon. He initialed my belly. Got, oh, TMI, Tuesday morning. Who would get their little friend, or time of the month, ladies, the day before surgery? Me. So I had to wear some sort of chastity belt rigged contraption before they put me out. And then when I woke up, of course, all I had was like a blue or a Chuck type disposable thing underneath me. But gross. I know, as nurses and healthcare professionals, I could care less. Like, taking care of a patient, whatever it is, what it is, go with the flow. But I didn't want that. So, yeah. And for you, those of you, I wear glasses occasionally. Just dawned on me that I kind of look different. And I did just get a shower. So I'm just like sweating because, wow. That I have a question for. I'm all over the place, but that's a question. All of the videos I've seen from people say that they get really cold. Before you got to the cold part and your metabolism was like crazy out of whack, like, did you just sweat profusely from the littlest of exertion? like pouring. I can feel it just dripping down my face. Yesterday, I took, it wasn't even a mile walk, uh, just a little jaunt outside. By the time I got to my destination, which, like I said, less than a mile, pouring, pouring. I was like, oh God, oh God. I'm fine. People are looking at me like I'm having a heart attack, like something's wrong. But yeah, look at that. I don't know if you can see the sheen on my forehead. Ugh. And I'm a sweater anyway, so tell me you've experienced this and it gets better. Because, yeah, freaking out. Oh, what else? Sorry, yes, I am all over the place. But anyways, the surgical part, great. Surgeon, great. All the surgical nurses and surge techs, amazing. Great experience. So let's get to my roommate, my first roommate. I get back to my room. Well, my surgery took a little longer than he anticipated because my stomach was slightly larger than he anticipated, he said. And I said, well, what does that mean? Did I have some sort of like ginormous anomaly? And oh my God, this is why I've been overweight and eating myself through every emotion and life change. No, no. He said that it was just a large stomach. It wasn't record breaking. It wasn't anything that he has pickled in a jar in his office. He said it was just a big stomach. I just have large organs. Period. Kaylee has large organs. We're a large organed family. Not my bones, my organs. Whatever. So that was funny. But anyway, so I get to my room. They have me hooked up to a PCA with Dilaudid that I can push the button for anytime I need pain medication. They have IV fluids running. And yeah, so I was in and out of consciousness. Like I said, I haven't had general anesthesia for years, since I was little. So I was aware people were there. I knew Michelle was there. My mom had stopped in. You know, yeah. Lady next door to me in the next bed decides that her and her husband are going to have marriage counseling 101, and they start arguing, and they're hard of hearing, and they're going and going and going. And, you know, I was starting to get nauseous. I could barely swallow my own spit. So I finally was like, you need to stop. You need to stop. Got rid of her, was alone for a little bit. Ended up with a new roommate who was a little better, but still hard of hearing. But yeah, it overall was a good experience. I stayed an extra day, just my blood pressure got a little out of whack and was a little high. And then they wanted to make sure that I could drink the protein shakes, which for me is Carnation Instant Breakfast, and a tablespoon of protein powder. And let me tell you, I did not appreciate everything that has gone before me, I said, until right now. And you don't until you go through it. Texture. Mama wants texture. I want to crunch on something. I want to chew on something. I'm tired of drinking sweet. I got broth heating up in the microwave right now. I have another week of this liquid stuff. I'm going to go to GNC here in a little bit and get some unflavored protein powder because, oh, I can't do it anymore. Yeah. My computer likes to shut me off at 10 minutes and I'm almost to 10. So I'm going to do a part 2 real quick. So I'll be back. Or not. And you just see awkward silence.